I'm Dr. Qi Chen from Renji Hospital in Shanghai, China. It's my honor to be invited to this conference. Today, I will introduce some experience about ultra-mini PCML. Our hospital was founded in 1844 by British. It's the first Western hospital in Shanghai and the second in China. Now we have 4 campuses in Shanghai. There are more than 80 doctors in our department. I'm the leader of the urinary stone subspecialty group. We have completed more than 4,000 surgery of upper urinary cavity in the last year, including 900 PCML. Thank you, Chairman Brookholz, for his trust. The 4th ESD conference was hosted by our department in 2018, and all of us left a good memory in Shanghai. In 2015, the inventor of UNP, my good friend, Professor Janek Desai, organized an UNP workshop in our department. At that moment, I performed my first ultrasound guide UNP in 12 minutes under his guidance. Now we have finished more than 400 UNP surgery. This is the components of UNP. The core instrument is the ultra-mini endoscope. It is only 3 French with 1 millimeter diameter. I will show you in the video later. This is the video of ultrasound guide totally tubeless UNP. First, we place a ureteral catheter into the renal pelvis on the lithotomy position for intraoperative artificial hypernephrosis and perfusion, and then in the wearing catheterization. Then we change the patient to the prone position and prepare for the operation. This is the components of UNP. This is an endoscope with 1 millimeter diameter. It is recommended to put into the protective shoes when not in use to avoiding breaking. There are 2 working channels on the 7.5 French inner shoes. One is connected to the perfusion pump, and the other is for the laser. The ultra-mini endoscope and the inner shoes are assembled together to form a Persian handpiece. The out shoes is 13 French, which has an additional flush channel. It can make stone fragments easier to be flushed out during the operation. The ultra-mini endoscope can be inserted into the out shoes of the puncture needle to observe whether the puncture shoes has entered the collecting system, which can make the establishment of percutaneous channel more accurate. This is the metal guide wire. And this is the dilator. First, the tachyid calyx was punctured on the ultrasound guidance. After successful puncture, the needle core was pulled out and we can see the fluid comes out. Then we insert the ultra-mini endoscope to observe all the structures from the skin to the collecting system, to check the position of the needle shoes. Then the guidewire is inserted into the collecting system. When pulling out the needle shoes, the depth of the needle was measured, which tells us how deep the facial dilator goes in dilation. After cutting 3 mm of skin and the dilation, the 13 French channel is established. In the expansion, it will rather be shallower than deep. Then we can adjust the outer shoes to the ideal position on the direct vision. We use Honian laser to smash the stone to less than 3 mm by combination of dusting and fragmenting. And then the sideline is perfused through 3 channels, including the inner shoes, the ureter cathode, and the additional channel on the out shoes to form a whirlpool effect and wish out stone fragments. Before the end of the operation, both endoscope and ultrasound were performed to check for residual calculus. After that, the guidewire was reinserted and the out shoes was gradually withdrawn from the collecting system to the outside of the body on the direct vision to check for bleeding. If no significant bleeding in the channel and the cathode, remove the guidewire and retain the ureter cathode. There will no double J left. The operation was finished and it would not necessary to shoot to the ward. On the morning of the first day after operation, the patient went to go CT scan. If there was no residual calculus and bleeding, the ureter cathode will be removed and the patient was discharged. This is the CT image before and after the operation. We can see that the stone has been basically removed without obvious bleeding and urine extravasation. Until last year, we have completed more than 400 UMP operations. Most of them are kidney stone located in lower calyx and renal pelvis. The mean size is 20 mm. The mean operating time is 30 minutes, and the mean hospital stay is 1.3 days. The stone clearance rate checked by CT on the first day after operation is 80%, and after 3 weeks is 87%. Most every patient with no double J and the PCN tube. There were some complications, but no one needed transfusion. Compared with RNIS, UMP has higher stone clearance rate, low cost, and no trouble by double J for 1 to 2 centimeter kidney stone. It is a safe and efficient surgery. Finally, thank you for your attention, and thank you very much for Professor Janek Desai and Chairman Burkholz. And welcome to Shanghai and the Wenji Hospital again. Thank you.